And the family of former President Noynoy Aquino announced that he died peacefully in his sleep on Thursday due to renal failure secondary to diabetes. Dr. Agnes Cruz of the Philippine Society of Nephrology Board of Trustees joins us via Zoom to explain that disease in layman's term. Good afternoon, Dr. Agnes. Now, we are all familiar with diabetes.
Good afternoon.
Yeah.
Yes.
So what is renal failure secondary to diabetes? Can you tell us how diabetes could lead to kidney failure? Is this common?
Yeah, thank you very much for the question. Actually, incidentally, June is Kidney Month, and we just recently celebrated Family Day of the Philippine Society of Nephrology. And one of the things that we want our listeners and our patients and their families to always remember are the 8 golden rules of having a healthy kidney, and one of which is treatment of diabetes, because we know in the Philippines and elsewhere in the whole world, diabetes is the leading cause of kidney failure. And these are the patients who would need dialysis or even kidney transplantation. So we always tell our patients to have their blood sugars controlled, to take their medicines regularly, because everything that is going on inside the body of a diabetic patient, the hyperglycemia or the high blood sugar of a diabetic person, can lead to complications, can lead to abnormalities in the blood vessels of these patients. And these abnormalities, these complications in the blood vessels could lead to kidney failure. So we always say, take your medicines regularly, control your blood sugars very well, control your blood pressures very well. Because if these patients who have had diabetes for a long time will have uncontrolled diabetes and uncontrolled hypertension, then it can really lead to kidney failure. And when we say ESRD or end-stage renal disease, that is the last stage in the spectrum of chronic kidney disease. Sean, we have 5 stages, stage 1 to 5. The last stage is what we call ESRD or end-stage renal disease. These are patients whose kidney functions are below 15%. And these are the patients who would need dialysis or kidney transplantation. So that is what happened maybe to our former president. He may have had diabetes for a long time. And with the long history of diabetes, with many other comorbidities, like maybe he is hypertensive. If a patient is smoking, that is also a risk factor for diabetes to develop complications. So we always say among the 8 golden rules of having a healthy kidneys, avoid smoking. That is not only for diabetic patients, but for all persons, in order to help improve the kidneys or to help prevent kidney complications from setting in.
Right,
Sean?
so definitely, Doc, everything, at least our bodily systems, our biological systems are definitely all connected. We do acknowledge that the
Yes.
president was a heavy smoker. But Doc, does this mean that the fact that it's end-stage renal failure already or renal disease, does this mean that the diabetes went unchecked for a long time? Meaning to say, I guess another way of asking this is, if we control diabetes and manage our symptoms, does this mean we can avoid hitting that end-stage renal disease?
Yes, yes, you are very right on those aspects. Let me expound a little. So some patients do not actually know that they have diabetes. So these are the patients who come to us already complicated. A lot of our type 2 diabetic patients are in this category. They see us when the kidneys are already failing. But there is also a group of patients who come to us much earlier. And these are the patients who know for the first time that they are diabetic. So these are the patients with whom we can do much intervention, because if we give them the proper medicine, if we monitor them regularly, if we advise them to eat properly, to exercise well, to stop smoking, to limit alcohol intake, to control their blood pressures, to take their medicines for hypertension, for cholesterol regularly, then we can help prevent the onset of chronic complications of diabetes among these patients. There are ways by which we can screen for kidney disease even among our diabetic patients. We check for the urinalysis almost every time. We ask for the serum creatinine at least once a year. We check for the kidney function, and now there is an app that we use in our cell phones to compute for the kidney function of these patients, so that when we see that the kidney function is going down or deteriorating, then we can advise the patients to have more strict follow-up, we can advise them on proper nutrition, and we can already monitor them very closely and plan for future dialysis among these patients. So your two questions are related in such a way that, yes, when we catch patients early, when we screen them properly, when we manage their diabetes, their hypertensions very well, and when they do see the doctors regularly, then we can help prevent the onset of complications. We can help prevent kidney failure among these patients. The other subset of patients are those patients who come to us late. But even if they come to us late, it's not yet a hopeless situation, because if they see us, the nephrologists, and if we monitor them and give medications and give proper advice to them, there is a way by which we can delay the onset of dialysis among these patients also. So it's never too late to see a kidney doctor if you see that you have problems pertaining to the kidneys. Sean?
All right, thank you so much for that very clear explanation. It looks like prevention is really the key, and at least early detection. So I guess your advice is very sound, to just keep having annual checkups to be able to detect this. Now, Doc, one last question before I let you go. Pinoy also did have open heart surgery. Do you think this could have factored in, as well as his age?
Yes.
Now, he's not exactly the oldest, but he is already officially a senior citizen. How do these factors possibly come into play?
Okay, let me go first to the age. As we grow older, whether you have disease or not, your kidney function goes down also. So that's a physiologic decline in kidney function, so to speak. So if you are 80, your kidney function has already deteriorated by as much as 40% from your normal. But still, that can be that your kidneys can still function very well, even if the kidney function is only 50% of its normal when you were much younger. So yes, the age of the president could have played a role, but as you said, he's not yet too old. He's only 61. But maybe it's the other comorbidities, it's the other things that our president may have. And the bypass surgery is very important, because when you already have a bad heart, when the arteries in your blood, in your heart, are already constricted or narrowed down, it means that the other blood vessels are also small or constricted, meaning even the blood vessels of the kidneys are also small, and therefore the kidney function can already be poor at the time. And when you have had a bypass, it means that the heart is not working too well. We have a spectrum of cardiorenal problem, meaning something that happens to the heart can also affect the kidney. And something that happens to the kidney can also affect the heart. So it's a spectrum of manifestations that can happen one at a time or together. The kidney and the heart can go haywire and can affect each other. So the history of bypass of the president is an important contributor to perhaps more rapid deterioration in his kidney function. That's why he needed dialysis much earlier than most patients that we have. Sean?
All right, thank you so much for parsing through all of that. That was Dr. Agnes Cruz of the Philippine Society of Nephrology. Thank you so much for your time, Dr. Agnes.